Guten Nachmittag, meine Freunde. Are we still awake today? Thank you for having me here in Berlin. Just a little bit of background. Actually, we started working in 1999 with an IVF clinic, and that was our introduction to the medical world. Prior to that, we had been a generalist marketing firm, and in the years intervening, we've devoted ourselves entirely to marketing IVF practices, oncology, urology, neurology, and so on. I do want to take just a moment, if I can indulge myself. This is my second trip to Berlin. The first time was August 13th, 1990. How do I remember that date? Well, it was very intentional. It was the 29th anniversary of the construction of the Berlin Wall. And this is my friend Gary Sorby here in the Rolling Stones t-shirt. He's in the Guinness Book for 3 records for long-distance driving. We started in Berlin. General Motors paid him to drive this SUV through the 6 Soviet bloc countries that had just opened up 9 months prior. So we drove through the 6 countries, starting here in Berlin, and I'm a little bit shameful because back then we had an idea that we should take home a little souvenir from the wall over here, and we did. We thought that was kind of clever, take home a couple of pieces, and I even bought a mask that had some pieces of the wall in it. And 22 years later, I'm back, and I found that the wall is gone. I feel terrible. I feel responsible for starting this destructive trend here in Berlin, and now you have to put a fence, a wall around the wall to protect it, and I feel responsible because I was in the newspaper for having done this 22 years ago. So my apologies, Berlin. I didn't mean to take one of your national treasures. So anyway, let's move on to something a little more relevant. 1990 was a long time ago. It was 8 years before Google. And back then, I'm going to speak mainly in the context of American medicine, but we were going through another cycle of this whole idea of managed care where patients had to go through general practice physicians, primary care doctors, and so on to be able to see specialists like reproductive endocrinology and infertility physicians. And back then, that was the gatekeeper concept, very big in the United States. It was supposed to save money. We got into this business by helping publicize the old-fashioned way. We would help get media attention to practices in hopes that they would attract some of the attention of those referring physicians. This is actually a practice, an IVF practice in California. They had one of the first IVF babies in the country, in the United States at the time. And we helped, a few years later, organize a reunion of their first 2 IVF babies who were 24 years old. So this is the 25th anniversary of that. It got coverage in the San Francisco Chronicle, and it got coverage actually the world over through traditional media channels. Well, a lot has happened since then, and what's happened is that what used to be fairly much of a simpler process has now become very complex, not just through the internet, but through cable TV, where you can see almost anything on television anywhere in the world. And this is very big for the healthcare world because there are TV docs galore all over the internet and all over TV, and this is where people get their information now. And now medical marketing is a conversation among patients, among providers, among family members, and so on. So we all know this. This is what's changed. This is a recap of what everyone else has said today, but the patient's in charge. And much of it is due to the healthcare webolution. You can see the change in the price of computers has plummeted in just 14 years. These are American statistics. They're actually 4 years old, but everybody has the internet, basically. Most of us have it at home. Age is no longer a factor. Age 65 plus and the lowest income people are the fastest growing adopters, generally, of the internet because they're the last ones to get it. 8 million internet searches a day on healthcare. 85% of Americans have a cell phone. The country of Bhutan was the last nation on earth to have television. It was banned there officially. Its 700,000 residents are mostly sustenance farmers. 75% of the people there make their living growing food with their hands. 59% of them have cell phones. And there are 48 places in the country of Bhutan, remote Himalayan country, where you can get internet access on your cell phone. So there really is a diminishing digital gap. except, and I don't mean to pick on anybody here, in this group, physicians. Now this is old, so let's say it's improved a little bit. But back in 2008, the New England Journal of Medicine found only about 1 in 8 doctors had even basic EMR. So 4 years ago, we'll give them a little bit of a break. This is all physicians. I think REIs are ahead of the curve here a little bit. Nonetheless, let's say it's doubled. I guess that's a relative statistical increase. So maybe 1 in 4 now have basic EMR. Harvard Public Health School found the same thing, basically. Very low adoption rate of the last few years. So this is the question now, who has the power? Well, physicians are sometimes a little behind the curve in some things, and now I think all patients of virtually all demographics use the internet for managing their health care. So we want to talk a little bit more about e-powered behavior, and I'm going to try very hard not to repeat what you've heard today. But there are a few more numbers here that are very compelling. 60 billion searches a month on Google. They had indexed 1 trillion web pages by 2008. Now if you type in child cough, within 1/3 of a second, you get 6 million pages sorted for you by Google. That is unbelievable. And this is why. This is a very important technology concept that I really want to drive home today. A website is what you have for your medical practices, what I have for my business, what many businesses have now. Google is a database. There's a big difference. This is a typical medical practice website. It's one of our clients. And you can see we might have several hundred files that make up that website. It's just like a bunch of Microsoft Word documents stored on a web server someplace. Google is an enormous database that has billions and trillions of bits of data collected over the 14 years they've been in business. And the amazing thing about Google is they will let you look at it. Google will let you look into its database. I know of no other industry in history that allows you to come into its warehouse and peruse through its goods. So if you are a little bit tech savvy, not very much really, you can learn to do this pretty quickly on your own. You can go to Webmaster Tools on Google. You can register your website. They'll give you a little bit of code. You can put that on your website. And you can use all kinds of tools to track what patients are doing on your website. Or you don't even have to do that. You can go to what's called the keyword tool. This is under Google AdWords. This is how they help you pick words to advertise for pay-per-click advertising. You can type in anything you want, and Google will tell you relatively accurately IVF, in vitro fertilization. I don't know that you can see those words where you're sitting from, but they're all related to fertility. Google will tell you relatively how many people are looking for those terms. And you can order that. Here, I only did these 6. You can order that by descending order of searches. You can also order it, you can also get ideas for more terms that people use similar to that. Why is that? Google wants to sell you some ads. They want you to use as many words as you can for your pay-per-click ads, and I'll get to that in just a moment. So I did this recently in preparation for this presentation, and I ordered them in, I took the keyword ideas. These are not the ones that I typed in, but Google said, you might be interested in knowing about these keywords too. And I was really surprised. Cancer showed up on this list. Pretty high. Worldwide, about 30 million searches a month people conduct related to cancer. It's right up there with pregnancy. In fact, it's a little ahead, 24.9 million for pregnancy. How can I get pregnant? 24.9 million. These are not exact numbers, but they will give you a relative comparison. We work with oncology, so I went in and I started looking at cancer-related terms. These are the 6 most common cancers in the United States, I suppose worldwide too. And I started looking at the names of the diseases, breast cancer, lung cancer, so on. And then I asked, well now, how often are people looking for doctors and specialists who handle these diseases? So I typed in oncologist, cancer doctor, cancer specialist, basically the first 3 or 4 most common terms I could think of. Look at the comparison. 3.35 million searches a month worldwide for the term breast cancer, 1.2 for lung cancer, so on. You get down to oncologists, 800,000 searches per month, cancer doctors, 60,000, cancer specialists, only 33,000. Well, here's an interesting finding, isn't it? People are certainly looking for diseases. This is not a scientific sample. I just took a handful of terms. I didn't search all terms related to cancer or all terms by any means related to cancer specialists. But what I did in a very random sample was find that about 7 to 1, people are looking more often for the disease than they are the people who treat the disease. It underscores my theory that I've been working on for years, which is people look for health information first and specialists second. Maybe no big surprise to anybody in this room. What still surprises me is how often I see this. Every time I try it for different specialties. I just ran a similar test a few months ago for mental illness. Found the same thing. It's the order of magnitude that's so surprising. In fertility clinics, you can misspell in vitro and still have 1.2 million searches of your fellow searchers who are looking for the exact same term every month. Only 110,000 people, Google says, in the same month are looking for fertility clinics, are looking for infertility centers. That's ranked 212 out of the list. Infertility doctors, 283rd ranking in popularity, 33,000 searches a month. Now I added this column here, very interesting here. This is a competition index that Google gives you. They want to tell you how much other people are competing to have this term show up in Google search rankings in pay-per-click ads. This is just pay-per-click advertising. This is not organic search, and I'll get to that in just a moment. So this tells you, in a quick glance, on the right, the competition is pretty low for in vitro, spelled with an E. You would expect that. It's quite high for fertility clinics, infertility centers, and so on. So the volume is high against a low competitive level. What does this mean? It's the marketing funnel. I hope most of you are familiar with this. This is a pretty tried and true marketing concept. Before anybody buys anything, they go out looking for information. They investigate. They think about it. It's a long trip downwards to making, through the funnel, to making a purchase. As we have here, where I live in the United States, most auto dealers, I think this is true in Europe too for other reasons, but they have what we call blue laws in the United States that prevent car dealers from opening on Sunday. It's kind of an anachronism, but you can't go buy a car on Sunday. So Sunday is the day, if you're just starting to look for a new car, that you go to car lots and you walk around without any fear of a salesman bothering you. You're at the top of the funnel. Maybe a couple of weeks later, when you've been to a couple of Sunday visit lots of car dealers, you go in and try to get a few brochures before a salesman can stop you and get out the door quickly. And then by then, another 3 or 4 weeks later, you've narrowed it down to 2 or 3 cars. You have the courage to go back, drive a car, and then sooner or later you go in and you buy a car. Well, same thing happens, I believe, in searching for health care. More sophisticated process in many ways. Healthcare services are what we call a considered purchase. So is a car, so is a house. But in many ways, it's the most considered purchase a lot of people will make in his or her lifetime. So, how does all this work into a patient decision process? Well, we have some research on this. It's from England. It's 10 years old now, but I consider it seminal. A group looked at 16 menopausal and perimenopausal women. They used very sophisticated eye tracking equipment as they went through websites on healthcare, looking for information about menopause. And they found there were 3 stages that these searchers went through. It's called a stage model of trust, was their conclusion. The first one is heuristic. That's a computer and mathematical term. As you know, it's kind of a trial and error. And what happens is at the time, 10 years ago, there were only 20,000 health websites roughly on the web. At the time, the first phase they saw was a very fast visual judgment. They looked at that web page and said, is this something that appeals to me visually? Very visceral, and visual. 94% they determined was based on that. Whether they would continue using that website, looking at that web page, and so on. They're looking to throw away web pages they don't want to see and get it down to a very small number they do want to see. When they did that, they moved, these consumers, these women, moved to the second phase, which is evaluative. Flip of the brain. Now they're looking at information on that page. Was it clear? Was it trustworthy? We've been hearing that word all day today. Careful assessment of content, 83%. Suddenly words trump pictures. It's not that important now to look pretty, but you had to look pretty to get this far. Or you at least had to look reliable. Lastly, this is a little more theoretical than they were able to prove at the time, but it certainly plays into today's uprise in social media. Is the website that I'm considering now personalized for me? Is it written by like-minded people? Is it for people like me? And does it especially have opportunities for me to find other people like me? So those were the three phases established in this study. Again, a very small study group, but I think significant because of the exhaustiveness of the study itself. So 3 phases, and what I have found is this actually works out to be true through a number of metrics that we follow on our clients' websites. And I want to talk about 4 phases of engagement, which is an extension of those 3 phases of initial investigation. This is my theory, but it is based on a lot of years of data. Investigator, questioner, initiator, and collaborator. And we've been talking about all of these all day. It's the funnel. The first phase is what people really see and what they respond to. And in our experience, it's these 4 things, including having some very good, non-commercial, clinical, patient-centric information. Can I find out about what IVF is? Do I have a reliable source for information on intrauterine insemination? How about endometriosis and how it affects fertility and so on? So we put medical libraries, minimum of 40 pages, on all our practice websites, because that's really what people want initially in the first phase. Are they instantly attracted to that? This is what's called a heat map. You might have seen this before. These were eye tracking studies. This is a Google search results page. On the left, you can see the hot zone where people tend to focus their attention. As you go down and to the right, there's fewer X's, fewer warm spots, less attention. These are the ads over here, pay-per-click ads. People are not focused on those like they are on the upper left-hand corner. So we try to design our website somewhat according to that, knowing that people are going to go down and to the right as they look at websites. I have a disclaimer. I'm in the business of selling pretty websites, or what we think are pretty websites. We do use professional designers. We think it makes an impact. We don't think it's demeaning at all to the practice of medicine. We actually think it's enhancing. And what you do see, and I picked an intentionally pretty scenic photo here. This is Pikes Peak in Colorado, one of the highest mountains in the state. We have a practice down in Colorado Springs. So you'll see that we use this incorporation of the eye movement in that way. And we also try to be quite colorful because we've been told by research that's what people are looking for. We've also been told by our own experience that they're not so much interested in the doctors, they're interested in other patients. So we try to really include that. We also have the medical library highlighted. This happens to be an orthopedic center, but we have it basically on all the sites. We find that talking like a patient to them, again, is supported by research. That includes a lot of definitions of clinical terms, a glossary, very good clarity for the layperson. Try to make it very browsable. I say idiot-proof navigation not because we think patients are idiots, because more they don't want to take the time to try to wade through complex information. Try to keep the number of words on the page, each web page in our library, 500 words or less. This is conventional thinking as well. And we use what we used to call in the magazine and newspaper business display text. That's headlines and subheadlines, and it makes it very browsable. So you'll see here, I don't think you can read it, but there are 4 bullet points that summarize what's in the article down below. This is because of a long-held theory, based on some research too, that only 1 in 5 newspaper readers actually read any one article. 80% of newspaper readers scan only the headline of one given article. Easy navigation, we always put in quick links in the section, you know right where you are in the website. Again, you can find your way out. These are called call-outs in the old magazine newspaper world. Lots of little info boxes, very browsable stuff. And then we optimize the site page by page, one topic per page. That's kind of the ironclad rule in search engine optimization. And then in many, if not most cases, we really recommend some pay-per-click advertising, especially for newer practices or those who've not had a website before. It's a good starter. However, I'm not personally a huge believer on living off of pay-per-click advertising for various reasons. So just in case some of this is still not clear, this is what a results page looks like. These are the ads. These are the results. The organic results are here. You have to earn those. As we saw and heard this morning, you can also change, by the way, your location. If I search for IVF in Denver, I can change it to Berlin. I get an entirely different listing. That's because Google knows where you are when you do a search, and they track that. Another important point that we've incorporated from the old days to attract more people to the website is news coverage. This is old habits to some degree, but we find that it does several things, including has enormous effects on search engine optimization. We also find it has enormous effects on reporters, which can have enormous effects on our clients. So we have a newsroom on every one of our every one of our clients' websites. We have our media contact on there, email and phone. We have a listing blog style of recent news coverage. This gives credibility to the practice. Media's cover them. They must be somebody. They must know what they're doing. This is all within a newsroom under this pull-down menu in the upper right here next to the search box. Again, I'm not sure everyone can see that. And in there, all kinds of patient stories, most of which we've written. Quite a few, though, are those that have been generated on behalf of our clients in the news media, in the conventional news media. It's getting harder and harder to get media coverage because the traditional media is shrinking. But often you can, and often you can online these days increasingly. That's where the media is going as well. Real surprising outcome. Not that long ago, we put out a press release. We put these things on web distribution services of the news. This was on behalf of a Los Angeles IVF practice. Very routine announcement. We just said that they were going to have a new finance program for people coming back for second and third IVF cycles. Nothing big about that. The news media is not interested in that. That's not really a story. Yet for months after this, for 2 or 3 months, I checked it regularly. If you go to Google News, not Google, but Google News, and you put in the term Los Angeles IVF, it's a very competitive term. In the United States, I think Los Angeles is the most competitive market for new patients in IVF. Very competitive term. Our news media release came up in number 2 spot in the organics. These first 3 are paid advertisements. After that, those are organics that you have to earn. Natural search, you have to earn those. 2 to 3 months, that was number 2, that press release. That's the impact that news has on search engine optimization. And here's the most interesting thing of all. They were above the news about Octomom. You know who Octomom was? The woman who had 8 babies from IVF cycles, as a result of IVF cycles. And even above Rod Stewart announcing that he was going to have a baby with his wife through IVF. So we beat Rod Stewart and Octomom in the newsworthiness with that one press release. Astounding to me. What I see, frankly, too often on all medical websites is so much of the attention is instead focused on the sellers, not the buyers. And let's be honest, I believe most people today in the medicine world really are sellers. There's nothing terrible about that. It's a reality we have to live with because patients have choice. As long as there's choice, there's going to be marketing competition. So we see too many practices, in my opinion, that are too much about the seller, videos about themselves, unsubstantiated claims, and so on. So we want to at least get them to the website, get their attention, and then engage them and make them become a questioner. So this we do by making a lot of changes on the website. On average, we make 23 changes per month on each of our clients' websites. We're putting new news on, we're adding new pages, new information, so on. We also are very rigorous about making sure there is a search engine on the site, not the Google kind, but this is one that actually is built into the website. Very proud of this. This is one of our clients. If you type in kidney stones on the website, you get 20 different articles on that website to read about kidney stones. Pretty good. I went just yesterday and looked at WebMD for the same search term. Typed in kidney stones. They only have 52 pages on kidney stones. Not bad. WebMD has been around since 1999, and they have 2.6 million pages of consumer health information. 52 is not proportionally more than 20 when you consider our client has a little less than 200 web pages on their website. Very proud of that. We also want to tell the patient story as much as we can. We can do that through social media. Tomorrow I have another presentation. I'm going to talk a little bit about online teaching through social media. We've covered that fairly thoroughly today. Facebook, we believe, is right now one of the 4 social media tools you should use, and it's because of popularity, but it's also because it's so very friendly to medicine, the practice of medicine. Facebook has a new formatting, by the way, that allows you to customize your Facebook page. This is the page that we set up for this fertility practice in Atlanta. It looks much like the website of the fertility practice. And when you go there, lots of the same information that's on the website repurposed for Facebook. The idea is to have repurposed information that's similar but not identical. You want to bring more people to your website. I believe, quite honestly, that a medical practice's website, for most practices or majority of specialties, depend on more people coming through their website as the principal online store. That's how people first get to know their doctor increasingly. So we do that through Facebook. We do it through Twitter. Now, the easy thing about this is these kinds of social media can be generated from what I called headwaters content. Blogging, physician blogging. This is the one thing we ask our doctors to do. Please write a blog at least once a month. If you need help, we'll write it for you if we need to. At least jot down a few ideas. We'll help you get a blog started. It will be on your website, and then we distill that and we promote it on the social media websites. So if we can get one physician blog per month, we're doing pretty well. In multiple practices, we can usually do a little better than that. And from that, we have a good supply of content that we can repurpose across the social media spectrum. This is one of our blogs from Colorado. You can see we've got a blog roll on the left. These guys are great. These doctors are fighting each other for blog contributions. We don't have any problem getting them to do that. We've talked a little bit about e-newsletters. I won't go into it a lot. We do have them for our clients. We have automatic sign-ups on the website. It's another way to engage the questioner. People can enroll for these. They can unenroll. It's all opt-in and voluntary. We encourage inquiries through a number of online forms. This is different from PDFs that you download. These are built into the website. You can see they're linked very prominently on the home page. Very easy to find. You can ask for an appointment that way. You can ask for more information that way. You can even apply to become an egg donor. This is a very complex form. It's about, I think, 8 pages, around 50 questions. We have designed the website, the computer basically the website lives on, to actually process the form and to grade the form so we can actually triage the applicants and send the best to the practice the fastest. Covered this today, activating the initiator by just being good at customer service. Lots of people have spoken about that. patient portals I'll get to here in just a moment. This is a fairly new thing, and our University of Colorado client is using an outgrowth of the Kaiser Permanente website. This has been adapted for the hospital at the University of Colorado, over 3,000 physicians. You can actually go online, log in, click on a link actually, go online and register with this website, behind the website, as an established patient, and then you have access to some of your health records. You can pay bills, you can renew prescriptions, and so on. This is a smaller practice, again in Atlanta. They've used the Intuit Health portal, very popular in the United States right now. They've got nearly 40,000 doctors on it. Very affordable, something you can add. When you do log in, it has encryption and other security means, so we meet all the HIPAA standards, privacy standards, and under state and federal law in the United States. I'm sure it would be the same here. And then, of course, once you become a patient and you made that first visit, we want to hear from you, because this has a lot to do with your online reputation management. So we provide survey forms on the website. When someone leaves that first appointment, they get a card with that address for the form. They can go on in minutes, tell us how their visit was. The idea here is to manage a little better. You can't control, but you can manage a really big challenge right now in the U.S. I would think it's the same in Europe and elsewhere. There are so many Rate Your Doctor websites out there, and anybody can say anything. They don't have to prove they're a patient. In fact, we've seen very good evidence in some very competitive situations where competitors of our clients posed as patients and said nasty things about those practices. How do you fight that? How do you stop? It's a free world out there. Well, one way you stop, or at least slow it, is you give people an opportunity to complain privately to you through something like the satisfaction surveys and address their complaints privately. And then you try to encourage, of course, the happy patients publicly. How do I know any of this works? After all, I am in the business of this. This is how we make our living. But I can show data, and I'll show some more tomorrow. We've seen where, when we take these things into account, 20% increase in visitors in 6 months through better optimization, better findability, etc. 20% growth in the number of visits in 60 days, 80% increase in people asking for appointments through the website and our online appointment forms. So now we get to the big question. All this sounds great. Man, I'd like to do this. I got to see some patients. I got to actually work. I don't have time for this. So if you don't want to hire a firm like mine, there's not a lot like mine, to be honest with you. We work on a retainer basis. It's several $1,000s a month. It's much less than one IVF cycle in the United States, so I think it's a pretty good bargain. But I'm sensitive to the fact that we're kind of trailblazers in this world, and marketing's not been an expense in medicine. And most practices are very wary about these promises and about marketing in general for good reason. So how do you do this stuff without paying somebody outside? Can you do it in-house? And I think that's a great question, because guess what? Your job really is something else. So this is kind of a core team that I think you would have to assemble if you are going to do this by yourself or independently of a firm. And you would need these 4 roles filled, and the fourth one is even on an as-needed basis. The first 3 are somewhat regular. You need these kinds of people working pretty much at least on a monthly basis. The only job the physician has to do is to help that team. He can have it in-house, she can have it in-house, but as long as he or she provides that team with good information that they can use for public relations, for new web pages, for social media, etc., and do an occasional blog, his or her job in marketing is done. The rest of the job is what it should be, taking care of patients. Why should we bother? I could spend 3 hours making the case economically, I think, and persuade a lot of you that this is the right thing to do. This is one of the statistics that I think is very compelling. We know how many new patients and how many total patients our practices are seeing every month. We make that a part of our business. And what we've seen is anywhere from 20 to 40 times as many people come to their website on a daily basis. To me, the practice's website is the most important real estate that the specialty can have. It's less true for other specialties, but in what I call pipeline medicine, where you need new patients constantly, the website is everything. It is your online clinic, and it is a place you can build trust. And we do see, by the way, that they see lift from this over a period of time. Typically, if they let us do all these things that we know how to do, we can bring them 10 to 30% increase in the first year in new patient visits. That's a pretty good ROI. It's in most cases 3 to 1 or better. And I do want to say that no matter how you slice it, we have to face the reality that marketing is correlative, is not causative. It's that old saying, I know I'm wasting half of my advertising dollar, I don't know which half. So I relate it to good health. Should I have 3 vegetables and fruit servings a day? Should I have 5 like the USDA just recommended? Should I exercise 3 times a week, 30 minutes a time? Should I go 5? I don't know. We don't know the exact answer, but we know if you eat your vegetables and break a sweat daily, you're going to probably beat the odds. Come out pretty good in the long run. I've got a book. It's on Amazon right now as an ebook. It's $9.95. The hard copy edition is going to come out later this summer. The price is going to go up. So get them while they're hot. I did bring some souvenirs for anyone who wants one. I've got pockets full of these bookmarks that are physical bookmarks. In it are 5 bookmarks that I think are very useful for physician marketing. Only one of them is my website. I hope that's a fair proposition. And I guess I want to say that this is the operative word and thought today, which is change. I can't believe how much the world has changed. 22 years since I was last here in Berlin. I see the changes in medicine coming virtually as fast, and who would have thought that the year after Google was founded, so much would happen to my company. It started us on a new course that brought me here with you today in Berlin, and thank you very much for having me.